Helen, you're from Malawi. How long have you been in Malawi?
Actually, my husband and I started in Malawi in 1987, so come January next year, it will have been 30 years when we first moved to Malawi.
You've seen a lot of things happen over the years in Malawi.
Mm-hmm.
Some good things, some
very
bad
good
things.
Yeah.
What's some of your highlights?
I think some of the highlights are working with our partner churches and watching them grow, expand, become more solid. The other big delight has been the opportunity to work in a lot of very large development programs that have assisted a lot of people across 2 or 3 of the districts of southern Malawi.
One of the important projects I feel is the water projects, and of course clean water, safe water, and you've done a lot of work in little communities and getting water to schools.
We have, and that's an ongoing project that's supported by the Canadian government, actually.
You do harvesting of water.
And there are different types of wells. There's hand-dug wells, there's boreholes, there's repair of wells that are already in the communities. And another aspect that this current water project is working on is building latrines at schools. The primary goal of that is to encourage girls to stay in school. And if they have better and more private sanitation facilities, they are more inclined to come to school. So that's been a really big thing.
That's one benefit. What about the water at schools? Because isn't that attracting teachers and keeping teachers at the school?
I think so. I think that having water accessible makes a big difference in any community.
Now you've taken on a big project. It's called Maternal Health, which was real important to the ex-Prime Minister of Canada, Stephen Harper. And of course a lot of international people have got behind it. Tell us about maternal health and what you're doing. Your version, of course, Promise is a consortium of 3 organisations. What's EI's commitment?
We are working in 2 TAs. We're hoping to reach about just over 21,000 women of reproductive age, as well as probably about 18,000 children under 5, with health principles and interventions at the community health centers in order to improve health, but also to reduce mortality.
And a lot of training. And are these birthing centres or are they just health centres?
They're health centres.
Right.
We will assist with something that's called birthing kits so that there can be clean, safe deliveries. But primarily there's a lot of training for people at health centers, in the communities, on various aspects of health.
Is this a safe program put out by the WHO and the training of hygiene?
I would say it certainly falls within World Health Organization guide standards for sure.
And what about the latrines at these health centres?
We're hoping to do some construction of latrines. Yes, we are. Just to upgrade facilities.
Helen, why is it important, maternal health? What are the outcomes going to be?
We are hoping that the outcome will be that fewer women die in childbirth, that fewer children die under the age of 5, that more people are able to live healthier lives, that they will understand principles of good nutrition and daily living practices that improve life standards.
Well, thank you, Helen, and have a safe trip back.
Thank you.